First up today, we welcome pediatrician Dr. Catherine Phillippi. Dr. Phillippi joined the beautiful new Trust Care Kids Clinic in Gluckstadt in January 2021. Prior to joining Trust Care Kids, Dr. Phillippi practiced at Children's Medical Group. Dr. Phillippi is married to Dr. Mark Phillippi, and they have 3 beautiful children. Dr. Phillippi is passionate about her profession, and she believes that God leads her in being an advocate for all his children. Please join me in welcoming Dr. Catherine Phillippi.
Hi, guys. So I'm here today to talk to you about puberty, and that is a topic that not many people are comfortable talking about. But today we're going to celebrate being a girl. We're going to celebrate how God made us all different and how our body changes, and we're going to learn about those changes and how they make us feel and how they affect us. And hopefully you'll walk away with a nugget, even if you don't remember everything. So I'm going to tell some funny stories. I'm used to giving this talk face to face, and I would love to be sitting in a den or somewhere where I can look you in the face and ask you questions. And I use a lot of stories about my girls learning about their bodies, which this being recorded, I hope they never see it because they will be super embarrassed. But I have a wealth of knowledge, not only from my upbringing and my childhood, but from my girls. And then, of course, being the partner with lots of families who have kids who are going through puberty. So first and foremost, we need to define what puberty is. And puberty is the process that your body goes through as you grow to change you from a little girl into a young woman. And the end of that process involves being able to reproduce or have children. So that process is a long process, but it starts around the age of 10. Now, that's average. Some kids start as early as 6 or 7, and some kids start as late as 12. So my girls were very different. My first daughter started going through puberty late. She was an athlete. She was very lean. She played soccer. And it has been shown that kids who are super athletic and energetic and muscular and lean do sometimes go through puberty later than the child who is more of a bookworm and who might be less athletic. So that process of puberty involves a lot of things. And I will say, I love that my girls used Wordly Wise as their workbook in school for vocabulary. And I always ask if I'm in the room with you, what does Wordly Wise mean? And it's self-evident words we learn to make you wise. And what do we learn about the words? We learn how to spell the words, we learn the definition of the word, and we learn how to use the word in a sentence. And so a brief synopsis of the pubertal process involves some words that we're going to talk about, define, and then I'm going to hopefully put them in context so that you can learn what they mean. So one of those words is hormones. And you'll hear sometimes, you might hear your dad say to your mom, "Are you hormonal?" Or your mom might ask you that or say, "You seem hormonal." Well, hormones are the chemicals that our body makes that float around in our bloodstream and attach to organs to stimulate them to change and become more mature. And those hormones can sometimes affect our emotions. So, for example, when you have someone do something to you that's really not a big deal, but you get so angry that you want to punch them in the face. That is sometimes because your hormones are raging. Sometimes you say things you don't mean. Sometimes you slam the door or act really ugly when you really are sorry after you have time to reflect and step away from the event. And so part of puberty is learning those surges of hormones, how they affect you as an individual, and then harnessing that so that you don't act impulsively and say things you don't mean or do things that you would not do otherwise. Hormones are really important, but being hormonal is not really that fun. So we have to learn creative ways to embrace that. And I hope our therapists, our counselors can help us with that. Some of the other words that we should talk about are just the general anatomy of the body. So we have organs, which I would ask this question, name an organ. And one of the organs that people usually say is like lungs, liver, kidney, heart. And I would say the organs that are involved the most with hormonal changes are the breasts, the skin, the uterus, which is the place inside a woman's body that a baby will one day live and grow, the ovaries, which are deep inside your abdomen. You don't see them, you don't really know they're there, but they're these tiny little organs that produce the hormones that we need to become a young woman. The word vagina is important. When I gave this talk to my oldest daughter and some of her friends, at the end of the talk, she raised her hand that she had a question, and I asked her what her question was, and she said, "Can you spell the word vagina?" And so I spelled it Vagina. And she said, "Oh, so all this time I was thinking it was a vagina with an F." So her nugget that she took away from my talk was how to spell vagina. And vagina is the word for the middle hole that a woman has or a girl has on their bottom, and it is ultimately where the baby will come out. So I have lots of funny stories about that with my girls, because one day Madeline, my oldest, asked me why she was the only baby that I pooped out. And I thought for a second, like, what is she asking me? And so she was the only baby that was born naturally. My daughter after her was born by C-section, and my son was born by C-section. So in her mind, I had pooped her out. So I had to gently explain that that was not the case. And I will tell you that when my kids were very young, so my son was a baby, and my middle daughter was 3, my oldest daughter was 5. I had put my son down for a nap, and I had turned the monitor on. So it was sitting near the door, and my girls were across the hall arguing, and I could hear that they were arguing. So I turned the monitor up, and I could hear them saying this, and you'll laugh. So my oldest daughter was saying to the younger daughter, "You're just 3 years old. You don't know." And the 3-year-old was saying, "Yes, I do. Girls have 3 holes." And I'm like, oh my gosh. And so the oldest daughter says, "No, they don't. That's so stupid. They only have 2 holes." And the younger daughter is like, "Nah, they have 3. And so I'm thinking, how does a 3-year-old know this? And so the older daughter says, "How do you know that?" And she goes, "Why would they have 3 holes?" And she goes, "One for TT, one for poo-poo, and one for diarrhea." And so I know you all got a laugh out of that because it's super cute, but it is true that girls have 3 holes, but there is not a special hole for diarrhea. So you have the front hole, which is called the urethra, and that's where TT comes out, or urine. And then you have the back hole, which is your bottom, and that's where it's called an anus, for those of you that want to be anatomically correct, and that's where you poop. And then the middle hole is the vagina, and the vagina opens up into the uterus. Okay, so the uterus is that organ I talked about that's low down in your stomach, and that is ultimately where the baby will live one day. So the other word is period. And so a period is that time of the month, we call it a menstrual cycle, where your uterus cleans itself out. And kind of the analogy I give for that is, think of a place on your body that is open to the air, but when you close it off, the inside can get dirty. The answer to that is your mouth. So you brush your teeth, right? You brush your teeth, you brush your tongue, you floss, you swish, and you spit. And you do that multiple times a day, at least twice a day, to keep the inside of your mouth clean. Well, God made us where our uterus would clean itself out, because clearly your uterus, you can't put something in your vagina that goes up into your body and clean out your uterus. That's crazy. You wouldn't be able to do that. So God made us where once a month, the inside of the the inside of the uterus sloughs off, which causes a little bleeding, and it comes out through your vagina. And that's the normal process. It's a healthy process, and it creates an environment that is healthy inside your body. So if you know that medically, it is safe, it's not scary. And if you understand that it's a purpose and plan in order to prepare you to one day become a mother, then that makes it even more special. So that process of sloughing or bleeding cleans out the inside of the uterus, and it comes down out of the vagina. So when that process occurs, it usually occurs once a month. And if it's normal, it comes every month, once a month. And that process of becoming a young woman means at the end that you're having normal menstrual cycles or periods once a month. That can start crazy, just like everything else in life. Some people start having a cycle or a period like clockwork. They have one, and then once a month from then on, they have a period. Some girls have a little bit of spotting, which that's another good word to talk about. Spotting just means you have a tiny little bit of bloody discharge or brownish discharge in your panties, but it's not a lot. And sometimes they'll spot or have a period and then not have another one for months. And I always tell my patients that it can take a year for your body to become in sync, where it has a period every month. If you are one of those that is very erratic, the periods that I worry about being erratic are the ones that come too frequently. So if you are having a period and then skipping several months and then having a period again, that doesn't worry me. It's when the period comes too close together. So every 2 to 3 weeks is too often. And the reason for that is if you're bleeding every 2 to 3 weeks, you can become anemic, which means your blood count can drop. And that's something that your doctor would need to know about, because sometimes we would have to give you medicine to stop that. Anyway, let's see. So puberty is a process, and that process is different. So one thing I want to talk about that's super important for the kids to hear me say is, there is someone in your class who is very mature, who is already developing breasts, who is already wearing makeup or shaving their legs or, looking really mature. And there is someone in your class who is not mature at all, who has not developed any breasts, is not having any hair under their arms or any of that. And I want to challenge you to be the girl that is tolerant and inclusive of all kinds of girls. That is the beauty of being in this world where we have all different kinds of people. If all I gave you to eat every day was vanilla ice cream, your life would be really boring. Even if all I gave you was let's say cookie dough ice cream is your favorite. Even if I gave you your favorite ice cream, but that's all you got to eat, you would get really tired of it. So the beauty of Baskin and Robbins is you can go there and have 51 flavors. And you can jazz it up with some sprinkles or some toppings. So I would challenge you that it's going to take a very diverse group of girls to rock this world. And so let's embrace everybody's normal progression through puberty. Let's help girls who are super mature not to be embarrassed or ashamed of their bodies. And let's help the girl who's really far behind, like my first daughter, not feel ashamed that she hasn't gotten there yet. Let's try to be inclusive and accepting, and most of all, to love ourselves well and not to be ashamed of our bodies or how we develop. So the very first process that starts to change for girls is when your hormones start to get a little crazy, I like to say, is your breasts start to develop, and that is called breast buds. And there are people who are who have a little more fat content on their body that will start to develop fat deposition where their breasts are. But when you touch that, it feels like soft, like fat. There's nothing hard, there's nothing tender. Breast buds often are tender because they're growing. They're not tender all the time, but if you mash on them, you're like, So breast buds are firm tissue that is clearly different from fat tissue. So there are girls who think that they've developed breasts, but really it's just fat that is deposited there. So there's a difference. And once you develop breast buds, if they're significantly changing within a year or so, you're probably going to start to have a period. If you feel breast buds and they stay the same for a long time, you may be on the longer end, where it might be a year and a half to 2 years. So I would challenge you to be aware of what your breasts feel like. That sounds crazy, but it's super important. Your moms have to check their breasts to make sure that they don't feel anything changing or abnormal about their breasts. So you need to know what yours feel like and get in the habit of checking ever so often. Sometimes if you're injured by someone like bumping into you with a book, your breast bud will become really tender. And if you're mashing on it all the time, it'll also become tender. It's totally normal for you to have some sensation of discomfort as your breast buds develop, but anything that involves redness or swelling or really severe pain needs to be seen by a doctor. So the most important first thing is breast bud development. Some people, before they even have breast buds, will start to develop hair under their arms or on their pubic symphysis or on their bottom. And pubic hair is very normal, but you can develop pubic hair way before you develop breast buds, and it doesn't mean you're about to start your period. Because like I said, the thing that's most associated with starting your period is breast bud development. So hair development can occur very early, especially of Native Americans, African Americans, Hispanic and Latino origin people. People with darker hair and just olive skin can develop hair on their bottom and under their arms early. So as that process evolves, you also will develop hair on your legs. And the idea of when to shave always comes up, and the question comes up in my practice. And my opinion of that is that there are cultures that accept not shaving. I think that it is a personal choice. I don't recommend that you start unless you're committed to continue, because once you start, it's very hard to go back. Your hair starts to grow in coarser and whiskery. And so in order for you to not have to shave all the time, I would wait until you're absolutely ready. And I think you need to get your mom involved, because shaving obviously you can cut yourself, but also it's something special that your mom wants to share with you. So with my girls, we decided together, and I had one that really could not wait to shave, and I had one who is a senior in high school now, and if she could not shave, she would not. I do think the shaveless removal there are shaveless removal creams like Nair that exist. You have to be careful with them because they are chemicals, and you have to test them on an area of your skin to make sure that it's not too harsh for your skin. But I think those are perfectly acceptable options. You, when you start to go through puberty, you will get body odor, which is caused by those crazy hormones, and you will get stinky. And the thing is, you don't want to be the stinky girl. You don't want to be the girl that people can smell, because a lot of times people can't smell their own body odor, and you get kind of used to it. And so it's super important that you clean your body really well and wear deodorant. I will tell you that I had to teach my girls, and I still have to teach my son this. Applying deodorant on top of body odor just makes floral body odor or baby powder body odor. It does not take the body odor away. So if you are stinky and you forgot to wear deodorant, let's say you want to go to youth group and you come home from school and you're like, oh my gosh, I don't think I wore deodorant today. I'm probably stinky. Get a washcloth and get some soap and water and clean under your arms with soap and water, because it is important that you wash off the odor. It loves to stick to you and you can't cover it up. So I say that with all the fondness in the world, because my girls have constantly tried to cover it up, and they come out and I can still smell them. And I say, now you just smell like a flower that has body odor. So cleaning under your arms, that is a topic that I could go on for days. Hygiene. Cleaning under your arms is really important with soap and water. Cleaning your face with soap and water, which I know we're going to have dermatology come talk to us about hormones affecting our face and creating more oil than normal and creating acne. Our hair has to be washed. Soap and water. You can't just rinse it out anymore, because you're starting to make more oil and your hair will get greasy and it will smell weird. So washing your hair, washing your face, washing behind your ears, washing under your arms, and then most of all, washing your bottom. And when I'm talking to girls about their bottoms, a lot of girls will come in and say that it burns when they TT, and I'll have to check their TT to make sure that it's not infected. Because when you have painful urination or when it hurts to go to the bathroom, sometimes it means you have an infection, but often it's just that they have irritation down on their bottom because they're not wiping good and they're not cleaning their bottom well. And when you wipe, you all know to wipe front to back to keep all the poop germs away from your TT. And then you may develop a little bit of discharge when you're going through puberty, which is just like a little bit of clear or whitish snot in your panties. I know that sounds really gross, but it's the truth. And that mucus discharge is completely normal. It just tells me, when you ask me about it, I would say it's your body waking up. Your body is waking up, and it's starting the process of going through puberty, and it's eventually going to lead to a period. So you want to wash your bottom every night. You want to use soap and water and rinse it really well, and then dry it. If you find that your bottom burns when you put soap on it, try to pick a very gentle soap like Dove. And if it continues to burn, I would challenge you that you're not washing it well enough. Because if you avoid using soap and water, because it burns, it will continue to burn because it'll stay irritated. And after you get all the soap off and you get out of the tub, you want to make sure to dry your bottom really well. So we've talked about a lot of information. Let me look at my notes and make sure I'm not. Okay, so one thing I want to say. Girls like to all be the same. So if you look back at my yearbook from when I was in 9th grade, everybody wanted curly hair. Everybody got a perm. I had a perm. I wore a lot of hair product and mousse and tried to make my hair is not curly. I use a curling iron to do this. So I wanted to look like everybody else. And now my girls have straight all one length long hair and no bangs. And a lot of their friends look like that. So just like I explained in puberty, your nature, human nature, is going to be to want to look at social media or look at magazines or TV or friends and be like them and fit in because you look like them. But with puberty and with our bodies changing, we can't apply that principle. And honestly, I think the principle of all looking the same stinks. And you have to remember my ice cream analogy on that. The beauty of being a girl is that we're all different and that we have tender hearts, and that when people don't include us or make fun of us, it wounds us. And it is something that even now, I'm almost 50 years old, and I still carry wounds that I got when I was 7 to 12 years old from people being judgmental or mean to me. So be very careful with your words. And then let's see. Oh, and I didn't tell you this. One thing that can happen, and it doesn't happen to everyone, but over half of the girls that go through puberty, I call it get a little fluffy. And by that, I mean gain weight. So you might even stall out on your height growth, and you may start to look a little chunky, and that is perfectly normal. Obviously, I want you to be healthy, and I want you to eat healthy foods. And sometimes with your best efforts, when you're going right before you go through the peak of puberty, you may put on some weight or stall out with your height growth. And that is perfectly normal, because once you go through puberty, your height will improve a little bit and your body will lean up. So don't give up hope and don't be upset about that. And then lastly, let's talk about scenario. The last thing I'd like to leave you with is to go through scenarios. I think anything in life that is scary or that you're not sure about can be easier if you role play out in your mind what you would do if that happened. And so to think about starting your period can be really overwhelming, but if you play out in your mind the scenarios, for example, what would you do if you started your period when you were at school? Or what would you do if you started your period when you're at a friend's house trying to spend the night? You need to think through what you would do. And I always suggest that you go through the aisle of feminine hygiene and protection and let your mom and you try to buy some products, panty liners, pads, tampons, and look at them. Take them out of the package, look at them, get familiar with them so that it's not scary. And then practice if you want to. Now, tampon wearing is a whole nother ball game, and you need to be all the way having your period regularly before you try that. I do think swimmers and gymnasts and ballerinas often do need to wear a tampon in order to perform their sport, but it's not a necessity for most people. It's something that you can wait on. But panty liners and pads are, you want to have practiced and pick out the one you like the best. And then keep a panty liner. I always say buy a special pencil pack or little bag and stick the panty liner in the bottom, and then put stuff on top of it and then stick it in the bottom of your backpack. That way you always have it with you and nothing will surprise you. I think if you happen to have a male teacher, I want to reassure you that every man on the planet knows about periods, and they have a sister or a mom or a wife or a friend who has periods, and they are going to be very sympathetic if they're a teacher. They have been through this before. You are not the first one. So I would encourage you to think of a safe person that you would go to and that you would feel safe with, and and maybe ask for help. I know that the guidance counselor is often the one that people think of, but you may have a teacher or a friend that can help you. So think through what you would do. Talk about it with your mom, because that's something she may have some great ideas, because she knows your life and who you see throughout the day. Anyway, so all of this is really overwhelming, but I want you to look at it as something really unique and special. And the fact that we get to one day look forward to being a mom, which I know you have a mom that's really proud she had you. And this is a perfect time for you to ask questions about that and start that dialogue, because you're going to go through this change just like she did. And she was like you one day. So she has a wealth of knowledge. And hopefully you'll have a good pediatrician that you can talk to about it. Anyway, that's all I have. So I hope y'all enjoyed, and ask questions if you have any. Thanks.
Wow, that was some great information. I wish I was privy to that information when I was a tween. I hope you guys are writing this stuff down. It was really great. Thank you so much, Dr. Phillippi, with providing us with such great information. Now, let's